Okay, this is going to be the cranial nerve assessment. Let's start by discussing the cranial nerves. Cranial nerve 1 is the olfactory, that's your sense of smell. Cranial nerve 2, optic nerve, that's vision. Cranial nerve 3 is the oculomotor nerve, responsible for pupillary constriction, opening of the eye, and most extraocular movements. Cranial nerve 4 is the trochlear nerve, responsible for downward, inward rotation of the eye. Cranial nerve 5 is your trigeminal nerve. This has motor and sensory function. The motor is responsible for temporal and masseter muscles, which is jaw clenching, and then the lateral pterygoids, which does lateral jaw movement. And the sensory function of the trigeminal nerve is facial sensation. The nerve has 3 divisions, which are the ophthalmic, maxillary, and mandibular divisions. Next is cranial nerve 6, the abducens. This is responsible for lateral deviation of the eye. Cranial nerve 7 is the facial nerve. It has sensory and motor. Motor does facial movement, including those of facial expression, closing the eye, and closing the mouth. And the sensory function of the facial nerve, cranial nerve 7, is taste for salty, sweet, sour, and bitter substances on the anterior 2/3 of the tongue. Cranial nerve 8 is the acoustic nerve, or the vestibulocochlear nerve, as we're going to call it. Is responsible for hearing, which is the cochlear division, and balance in the vestibular division. Cranial nerve 9 is the glossopharyngeal nerve. It has sensory and motor. The motor part controls the pharynx, and the sensory is the posterior portions of the eardrum and ear canal, and the pharynx, and the posterior tongue, including taste, such as salty, sweet, sour, and bitter. Next is cranial nerve 10. This is the vagus nerve. Has sensory and motor as well. The motor function controls the palate, the pharynx, and the larynx, and the sensory function is of the pharynx and larynx. Cranial nerve 11 is the accessory nerve. This has motor function controlling the sternomastoid and upper portion of the trapezius. So that's shrugging and then turning your head side to side. And finally, cranial nerve 12, the hypoglossal nerve, that controls tongue motion. So we'll begin the assessment. We're going to start with cranial nerve 1, olfactory. We're going to test the sense of smell. And I'm just going to ask the patient to close their eyes and smell what I'm holding, and they can identify either an alcohol prep or coffee grounds. That would be a good test for sensory of smell, olfactory, cranial nerve 1. Next, we're moving to cranial nerve 2, the optic nerve. We're going to test gross vision, and this may be inferred from pupillary response to light, and then visual fields by confrontation. So I'm going to ask the patient, cover one eye, stare straight at me, and then tell me when you can see my fingers move. Very good. Very good. Very good. And very good. And we'll do that in both eyes. And that is visual fields by confrontation. Next, we're going to move to the 6 cardinal directions. We're testing extraocular movement. If you remember, looking down and in is cranial nerve 4. That's the superior oblique muscle. And then looking out is the lateral rectus muscle, and that's controlled by cranial nerve 6. All other motions are controlled by cranial nerve 3. So we're going to have the patient follow my finger. We're looking for good normal conjugate movements, no nystagmus. A little bit of nystagmus may be normal. Okay, all those test normal. That's extraocular movements, testing cranial nerve 3, cranial nerve 4, and cranial nerve 6. Okay, we're going to move to cranial nerve 5. This is the trigeminal nerve. Again, this has motor and sensory. So we'll test the motor function first. I'm going to go ahead and feel their face and ask them to clench their jaw. And we're feeling for the temporal muscle and masseter muscle. And then the sensory function of cranial nerve 5, the trigeminal nerve, we're going to do light touch to bilateral forehead. That's the ophthalmic branch. Light touch to the bilateral cheeks. That's the maxillary branch. And light touch to the bilateral chin is the mandibular branch. That's cranial nerve 5, trigeminal. We already did cranial nerve 6, which was the lateral extraocular movement. Moving on, cranial nerve 7, this is the facial nerve. This nerve also has motor and sensory function. So we'll test the motor function first. Can you go ahead and raise your eyebrows for me? Very good. Clench your eyes shut, and here we're going to try and pull them apart. Ask the patient, don't let me pull them apart. Good, strong clenching of the eyes shut there. Okay, next we're going to ask to smile. And can you frown? Very good. Bare your teeth. Very good. And puff out both cheeks. Okay, very good. Next, we're going to test the sensory function of cranial nerve 7, the facial nerve. Again, this is the anterior 2/3 of the tongue and the sense of taste. So we'll give them something salty to taste, something sweet, something bitter, and something sour, and just have them distinguish those tastes for us. Moving on, cranial nerve 8. This is the vestibulocochlear nerve, responsible for hearing. First, we're going to test sense of hearing by rubbing our fingers next to the patient's ear approximately 40 centimeters away and just say, tell me when you can hear the sound. Okay, very good. And we'll do a Weber test, which is going to assess for lateralization. You hit the tuning fork, place it on the top of the head, and ask them, do you hear the sound more in the middle, on the right side, or the left side? And it should be right in the middle. And also we'll do a Rene test to compare air conduction and bone conduction. Hit the tuning fork, have it outside by the ear. Can you hear this? That's testing air conduction. And then put it against the bone right here. Can you hear this? That's testing for bone conduction. And the air conduction should be a little bit louder than bone conduction. That was cranial nerve 8, vestibulocochlear nerve. Next, we're going to move on to 9 and 10 together, the glossopharyngeal nerve and the vagus nerve. We'll test the motor function here. Do this by asking the patient to say ah and observing for symmetric lift in the soft palate and the midline position of the uvula. So, ah. Okay, that looks good. Motor function, cranial nerve 9 and 10. And the sensory function, cranial nerve 9 and 10, we're going to elicit a gag reflex bilaterally. And that should be just fine. Next, we're going to assess cranial nerve 10, the vagus nerve, by itself, the sensory and motor function. For the motor function of the vagus nerve, we're just going to listen for a hoarse voice, and that could indicate some vocal cord paralysis. And the sensory, we're going to use the posterior portion, or the wood portion of a Q-tip, and check the posterior portion of the ear canal for sensation. And that should be good bilaterally. Moving on to cranial nerve 11, this is the accessory nerve. This does musculature, the shrugging of the shoulders, and then lateral rotation of the head. And that's the spinal accessory nerve, cranial nerve 11. And finally, the hypoglossal nerve, cranial nerve 12. I'm going to ask the patient to push their tongue against my hand through each cheek. So, okay, very good. And very good. And that concludes the cranial nerve exam.